why would we want to do an EHR? Well, I had been wanting to do EHR for a long time. I had been thinking about it, looking at it as a long-term plan for my practice. For many years, I started actually looking at EHRs in 2003, I think, at an AFP meeting. We wanted to be more efficient. I was very tired of writing the same thing 10,000 times all over the place. I wanted to do better quality as far as reading the record goes. My handwriting is, one of the pharmacists in Ahwatukee says, the worst in Phoenix, but I'm not so sure about that. Maybe.
It's true.
Anyway, I wanted to have better quality. I wanted to be able to do reporting better. I mean, it was just difficult. We had a practice management system, which was very cumbersome during any kind of reporting. I want to know how many diabetics I had. Well, about 2 weeks later, my office manager would bring me a report, you know. So we wanted to be able to quickly access reporting, you know, and to help improve our quality. And we wanted to, of course, you know, save all the paper that we use. When I first went to look at all the EHRs, I looked at all of them and I said, oh man, this looks like a chart. I can actually look at it. It actually feels like something that I could use. It didn't feel foreign. And so and actually their customer service and support at that time, their follow through in their sales was one of the deciding factors for me as well. They kind of stuck with me through my decision process, you know, presented new updates to me all the time. Well, we have this now, just letting you know, and were with me on this all the time. I liked Practice Partner because it was very, very flexible, adaptable. I realized we could maybe change things ourselves. I knew many of the others, if you wanted to change something, you had to ask somebody, and then it had to be done by some corporate office, and then you could, but this one we could do a lot of things ourselves, I thought. And of course, one of the big things, which was not called Bright Note technology in those days, but that's what they call it now. Called it dot codes when I started looking at this, was where you can enter one thing in the record and it goes everywhere it's supposed to go. So once again, back to my efficiency thing. If I enter an allergy, it's allergy everywhere. If I enter the vital signs, they're where they belong, you know, and we can show you later how we use the Bright Note technology to bring data into our progress notes. We're going to demonstrate some of that so that we don't have to be looking through charts for anything. We enter the hemoglobin A1C one time and it comes in the diabetic template when we want to see a diabetic. It says when our last one was. And it's just very, very powerful. The other thing was really the opportunity for research, and the previous speaker also spoke about PPRNet, which we are actively involved in. We're actually involved in a research program right now about alcohol screening in primary care. Very exciting things going on with PPRNet. They pool practice partner user data. In a database, we get quarterly reports. We get graphs. How are we doing on our hemoglobin A1Cs? How are we doing on this? Are our hypertensives controlled? Are we using medications appropriately? A variety of things. And so it's a very, very powerful tool for improving our quality, and that's why we like to belong to PPRNet. And also the cost. You know, the cost, even when we didn't have a hospital supporting us, we did this out of our own little pocket, was much more reasonable than any other EHR that I had looked at. And I said, well, I could actually maybe afford this, which we eventually did. So we're going to talk tonight and go through some of these things quickly. When you think of how are we going to go from having paper to paperless, it's an incredible job. It takes an incredible amount of work and it takes an incredible team. I think one of the things that I had failed to mention earlier was we as a doctor team have been very, very together on this, and I think that's very, very key. You have to have the doctors on board, and then you have to bring your staff on board. If you don't have leadership that has a vision about having the EHR and making sure that, and they're sure that it's going to work and we're going to do this right, and it's going to happen, then it's not going to happen as well. You know, so we're a team together. When we had a problem, we would recess to our doctor's office, which is just a bunch of little carols in a room, you know, fix the problem, go out, okay, this is what we're going to do about this. And we got through it. And it was a lot of work. I'm not going to say it wasn't. You know, we were bleary-eyed for probably 2 or 3 months, and a little bit bleary-eyed for almost 6 months. But after that, even some people who weren't as enthusiastic as I am, or Dr. Fishback was, came on board, and we got rid of those charts. And we'll talk about how we did that later. But we had to figure out how to make the chart into an EHR. Instead of writing, we type actually and click. We click and type. And certainly you could dictate and scan in. We did that for a while. We had a doctor who did that for a while. And then you can also do drag in. We never did that, but I know that's possible with this EHR. And there are lots of people doing that. Instead of faxing and mailing, we scan. So we have very little mail coming into our office, and we don't mail very many things out. We fax. We ask all our specialists, please fax everything to us, and it goes right into our review bins. You know, saves people opening mail, saves postage, a variety of things. And then also, it also helped us with our internal messaging and our internal communication in our office. Instead of having whiteboards where people write on and bulletin boards all over the place, we have a practice partner has a great messaging system which we can use to just communicate within our office. This is just an example of me walking down the chart. This is exactly how I looked almost every night. I'd have all these charts that I'd have to carry back down to my office to finish, because I'm not a chart finisher usually. But now I'm finished, and I'm finished, and I carry my computer back to my office, and everywhere I go, it goes with me. And I have my medical record with me all the time. This is just an idea of our timeline, just a brief idea. Certainly it could go quicker than this. We purchased Practice Partner directly from McKesson, and I think there's probably some advantages from using a corporation like AZCOMP because we had to do some groundwork and footwork ourselves that you might not have to do if you had somebody like them working with you. I purchased Practice Partner in February of 2007. We started scanning our old charts, and we can talk about that system. We developed a system for scanning old charts, which we think worked really well. We started practicing with that system with our what we called a DNU chart. The person who has 5 volumes. We had the 4 volumes in storage, and so we started scanning the old volumes, to practice on the system. And then we started our what's called configuration. And in the middle of this, we had to do hardware, and that was what was a little bit difficult. We had to figure out our hardware. We were kind of on our own. We got some guidelines, but then we went through several different vendors before we decided on which hardware to buy. And we were very pleased with what we did, but it took us a while to get there. That was why it's so long from when we purchased to when we started, because we were dinking around trying to figure out what hardware and things like that. We pre-registered our first month of patients, and then we went live on August the 13th, 2007.